came to Michigan Medical School as an English major, and I was terribly bored by the first 2 years of medical school, which is all memorization. And a dear friend of mine introduced me to a man named Horace Davenport, who was a professor here at Michigan, who was writing about the history of the University of Michigan Medical School. And from there, I developed an interest in the history of medicine. After medical school, I went to Johns Hopkins and trained there as a pediatrician and got my Ph.D. This is the mid to late 80s, right at the beginning of the AIDS pandemic. And I became more and more interested in epidemics and the history of quarantines and socially mediated ways of separating them from us. And then that was largely inspired by the AIDS epidemic because most of my early patients were gay men or intravenous drug users, two groups that were stigmatized for lots of reasons long before AIDS struck. So I mined that vineyard, or quarried that vineyard for many, many years, writing about epidemics as a historian. And then influenza happened, meaning bird flu influenza of 2005. And so the federal government asked me and my colleagues at the Center for the History of Medicine to study the efficacy of, say, quarantines or school closures or public gathering bans during the 1918 flu pandemic. And we studied we're up to about 60 American cities, and actually showed that cities that did this early and layered and for a long period of time did far better than those that did not. Now, there's lots of social costs to all this, but this was the worst pandemic in all history, and that's what they were predicting if bird flu became easily acquired. Thankfully, it did not. But that work just began a lot of collaboration with the Centers for Disease Control, which I still work with to this day, and developing public policies for pandemic preparedness. So it was a great journey, if you will, from studying old things, things that are dusty and musty, to their absolute relevance at the highest offices in this land and around the world. I've always been interested, as an offshoot of my interest in infectious diseases, by vaccinations. And of course, as there's pro-vaccinationists and anti-vaccinationists and politicians getting into the fray, perhaps needlessly and some might say somewhat cynically, there has long been a need for people to not only advocate for vaccinations, which if you took the top 10 greatest hits of medicine, they'd be probably 1 through 9, and probably I'm understating it a bit. But that type of research focus has been interesting to me as well. Through my work as an editor, I've been very involved in reading about and looking at the policy of the Affordable Care Act, both as it evolved in the 20th century and reached one high point with the passage of Medicare and Medicaid 50 years ago, or just a little bit over 50 years ago, all the way to the recent Affordable Care Act. And now, as it rolls out, we are seeing far many avenues of improvement or tweaking that needs to be done to the law and the policies it engenders. What I hope my work does in the present, and perhaps the near future, meaning like next week, is that it helps elucidate very complicated and complex matters a bit, and that I contributed to that conversation. It's very important to me as a scholar to talk to the public and to explain these complex topics as best I can to others as well. So if I added a little bit of comprehension to a very difficult to comprehend world, then I think my work is done. The benefits of vaccines, all vaccines, far outweigh the risks. It is an incredibly important responsibility for all of us to be vaccinated. You make that case day by day, patient by patient, and some you will convince, some you will not be able to convince. But I think we have to work very hard as doctors and public health policy experts to allay concerns, to answer and address questions, and to demonstrate time and again that these vaccines can and do work very well. I think what Dr. Ayanian and his staff have done really brilliantly, de novo, out of nothing, have created an institute and have built and furnished a really wonderful home for all of these experts to get together in a collegial and supportive, and positive way. So that to me is what is really exciting about the Institute. And it's had a very auspicious start, and I think it's something really quite wonderful that we've had scholars who do all this stuff, but to have them all under one, if not physical roof, a virtual roof. There's never been a better time in human history to get sick, other than today, with the exception of tomorrow, because medicine will be even more advanced in the days and weeks and months and years to follow. And it's also a scary time for American medicine in particular. There are many interests. Some of them are quite legitimate, but they're not necessarily what's best for the health of our nation. And how do we navigate that stormy waters of vested interests, of the greater good, of the public's needs, of the individual's needs? The American people tend to do the right thing, and for the right reasons, just not always on our timeline. So my historical reading is I'm confident we will navigate these waters, but we have to do so with great care, with great thought, and with great evidence.